Now to talk about flattening the curve in Illinois is Dr. Emily Landon, Executive Medical Director of Infection Prevention and Control at University of Chicago Medicine. Doctor, thank you for your time. We see these numbers, almost 200 deaths today, between 2,000 and 4,000 new cases a day, yet other metrics seem to be improving. A lot of people don't really know what to think. Where do you think we are right now?
Well, I think we've been able to flatten the curve. That means that the overall trajectory is like a flattened hill. And so we're expecting to see sort of a prolonged peak. We'll stay about at the same level for a while, I guess, and then come down again when the illness has sort of burned its way through the community as much as it's going to.
Do we have any idea when that could be? A lot of people want to reopen businesses. Governor Pritzker is saying, let's just wait a minute. We have got a 5-phase plan that we're going to do, and we're going to talk about the data. But when do you anticipate that? Some are saying fall, we may see another spike.
Well, we're going to see a spike whenever we stop paying attention to the rules about wearing masks when we're out of the house, about keeping socially distant, and anytime we start seeing crowds, then we're going to start seeing a spike in cases again. So the second wave of this infection is, in my opinion, and the opinion of many epidemiologists and physicians, of our own making.
Is that what worries you the most, doctor, at this point?
Yeah, I think that there's still a long way to go before this disease will run its course, so to speak. That would require upwards of 60 to 70% of us to get the virus. And currently we're at about maybe 5 or 10%. Even New York City only had about 25% of their people become infected in that major spike that they had. Until we have a vaccine or an antiviral that will keep people out of the hospital, this disease is going to continue to circulate. And the best things that we can do are keep our distance from other people and use personal protective equipment like masks, maybe even face shields if we turn out to need them, things that we do to protect ourselves when we're taking care of patients in hospitals.
When we were younger, you might remember parents would take their kids over to get the mumps or to get the chicken pox and things like that to get herd immunity. Is that crazy to do in the year of coronavirus?
It's definitely crazy. This is not the flu. I don't recommend that for chickenpox or for any of the other viruses or things that you've mentioned. You never know how it's going to react in any one individual, but I especially don't recommend it with this coronavirus. First of all, if too many people get sick at the same time, this virus can spread like wildfire. Back when they were doing that for chickenpox, there were still a lot of immune adults out there that would help protect those little groups from spreading too far. We don't have that right now, and so even if kids get sick now, there's a good chance they'll spread it on to adults with complicated medical histories, maybe other medical problems. And we certainly do see a fair number of individuals with no medical problems who require hospitalization and even critical care. They're highly unlikely to pass away from this disease, but that's not the sort of thing that we need.
We just saw in Wuhan where they have 6 new cases and they're going to test 11 million people. There's been so much talk about testing here. Do you think we're prepared for what's ahead if and when there is a second wave?
Testing is a really important strategy, and it has to be done in the right way. The right people need to be tested at the right times in order to identify who may be carrying the virus. But it's so important that we remember, while a positive test gives us a good idea that that person is contagious and definitely has coronavirus, a negative test doesn't mean that you are perfectly safe and definitely don't have coronavirus. We don't know how good the test is at picking up coronavirus, even contagious individuals who don't have symptoms. And so we have to assume that anyone, including me, including you, could be carrying and even transmitting coronavirus anytime. That's why the social distancing measures, keeping the density of individuals out in crowds low, and wearing our masks and or any eye protection if we need to do that as well.
All right, Dr. Emily Landon, thank you so much. Executive Medical Director of Infection Prevention and Control at the University of Chicago Medicine. Be safe, be well.
You too.
Thank you.